My name is Michael Campbell, and I'm the project manager for the African American Tobacco Prevention Network.
Okay. Michael, I understand you wanted to tell us a little bit about the FACT program.
Yes, I do. As a project coordinator, I work with adults and I work with youth. And one component of what we do with tobacco prevention education is getting youth involved and doing peer-to-peer education with their peers, ages 13 to 17. The idea behind that is to arm those youth with information about tobacco, make sure they know the truth about the harm that it can cause, about the addiction, and giving them some conversation, a way to be able to start conversation with their friends so that we can prevent another generation of youth from becoming addicted tobacco users.
Why is this necessary? It's not legal to smoke, and the ads are aimed at adults anyway, so why do we need to do this?
Well, we believe that. It's, we all know that the law says that it's not legal for youth to be able to purchase youth products, but I've personally seen youth go into retail stores and be able to do that. In some neighborhoods, particularly in the ones that I work in the African American community, not all retailers are going to check for IDs and going to verify that those youth are adults or not adults. So there's still some education that needs to be involved around that, and there's still some reinforcement to that law that needs to take place. So yes, the law says you have to be 18, but that's not always the case.
Is this going to make any difference anyway?
It will make a big difference, especially when you think about the economy that we're currently in, and you think about all the budget cuts that Wisconsin is experiencing. One part of those costs that the state has related to healthcare. So if we can prevent youth in the beginning from using tobacco products in the first place, and becoming addicted to nicotine, there's millions of dollars that can be saved by giving them that information and getting them to not even use them in the first place. Millions of dollars be saved in healthcare costs for the state, lost wages for employers. The savings go on and on.
Thank you, Michael.
You're welcome.
Hi, my name is Anna Carpenter, and I work with Rethink, Winnebago's Healthy Living Partnership out of Winnebago County, and we're here today to celebrate the 3rd anniversary of Wisconsin's smoke-free air. And I just wanted to celebrate the year, or the 3 years past, I guess, and let you all know it's been a success so far. We've had a lot of very good feedback from restaurants all over, and bars and taverns and bowling alleys. So if anyone has any questions, go for it.
Do you feel that business has gone down since the smoke-free air law?
No, not in our community. There have been a couple people who have mentioned that as being something that happened, but actually we've had a lot of reports of increase in business, and people are more willing to go to these different places because they are now smoke-free.
Shouldn't it be a bar owner's right to decide whether smoking is going to be allowed in his establishment?
It's a public health concern, and we're concerned about all people. Just because one person has a right to smoke somewhere doesn't mean that everyone else should be forced to breathe in that air that's polluted.
Well, but can't they go to someplace else that has a smoke-free law or has a smoke-free rule?
Regardless of the place or situation, having a smoke-free air law and policy in place keeps that environment safe for everyone.
Anna, this is really great. How did you get involved in tobacco prevention and control?
Well, it actually started when I was very little. I grew up with a public health nurse for a mom, and she was very influential in my city in creating a local ordinance for smoke-free policies. And so I was a little kid there with my no smoking button right on my chest, right alongside promoting smoke-free air.
So have you talked to any of the people who work in some of these business establishments? How do they feel about it?
I've talked to quite a few different establishment owners and workers, and they are all very supportive of the new policy and say it's a lot easier for them to work and be in that environment because they no longer have to breathe in the smoke.
What's going to result from this law? Are we going to have fewer cases of cancer?
That is the hope always. When you start reducing where people can and cannot smoke, that is increasing the amount of clean air around, and it's also deterring the use in general of these products.
Are there any studies that have shown health benefits from other states or places that have been smoke-free longer that have shown health benefits?
I am not sure. I can look it up and get back to you though.